I pray to God that you guys are able to pick up this technique, because I know that if you do, it'll change your life, it'll give you some quality of life back, and it'll give my life and my struggle, my horrible situation that I've been through, it'll give it some meaning if you guys can get some benefit from this technique. And I know for a fact that if you learn this, it's going to change things. It's going to improve your lives. It's going to help you get that mucus out. It's going to help you breathe. These photos show thick mucus I've coughed out using this technique, along with my pulse ox readings when mucus was trapped in my airways. I know it's gross, but it's real, and I'm showing you this to give the method credibility. If it works for somebody with a case as severe as mine, it ought to work for a lot of people. The technique takes practice and has a bit of a learning curve, but I teach the entire thing freely in this 20-minute video. Everything you need to start clearing mucus is right here. You may have tried techniques like the huff or breath holding before, but they often don't work as well on their own for more severe cases. The game changer here is using them in conjunction with the adaptation of support, a technique that professional vocalists use in order to control the muscles employed for breathing both in and out when singing. These techniques are going to upgrade your coughing mechanism into a finely tuned machine. By the way, if these techniques help you at all and you want to say thank you, just go ahead and stream some music from one of my channels or from Spotify. Either or will really help me, and it doesn't cost you anything. Also, quick disclaimer, you may want to consult with your doctor before trying these techniques, especially if your bones are fragile. Honestly, in my case, they've really helped take a lot of the pressure off my bones, but everybody's case is different. I do strongly believe that employing these techniques will actually take pressure off of pretty much anyone's bones because of the way that it works, mechanically speaking. But since I haven't been able to test this clinically, I can't say that for sure, and you'll have to do this at your own risk. And again, it's a good idea to consult with your doctor on this one too, but usually it's helpful to use your rescue inhalers before trying to cough thick mucus out, and honestly it's best to use them early in the process if you start feeling an exasperation coming along, rather than waiting until you're in a full tilt attack before trying to use your inhalers. They're better at preventing than they are at actually treating, but again, it's a good idea to ask your doctor just to be 100% sure. But generally speaking, they definitely will help you get the mucus out, especially when employed with the following techniques. Hey everyone, my name's Jamie O'Brien, and I am a disabled / chronically ill musician. I got sick when I turned 26. I got really sick basically overnight. My body was totally destroyed. I've got a longer video if you want to know my full history, but this particular video is going to be about something that was really important for a lot of people with chronic illness, especially chronic respiratory disease. By the way, I'm 35 now, so I've been around the block now, right? I've been doing this for a while, unfortunately, and I've learned some tricks to make maybe some people's lives a little bit easier, and I wanted to share them with you. So this is something that I think people go through a lot who have chronic respiratory disease, and the medical system really doesn't provide much relief. The various options that are out there are not particularly effective, but the issue at hand is thick, super glue-like mucus that you just can't get out, that drives you insane, right? And in my case, it's so bad, it's so thick, that I've actually broken ribs in double digits now at this point. So I think, I don't have the exact count, but I know I went over 10 a couple fractures ago, put it that way. I've also fractured my spine a few times from this. I have severe osteoporosis that doesn't help, but I've had to find ways to work around this issue. I have had to find ways to survive, ways to get the mucus out without breaking my bones and without destroying my vocal cords as bad anyway, and without triggering severe asthma-like reactions, because that's something that can happen when you're trying to hack this mucus out for so long and you can't get it out, and then eventually your lungs start to react in a sort of like asthma sort of response. Okay, so here's the deal. I'm a vocalist, okay? That is my life's love, I guess you could say. I love to sing. It's everything to me. It was largely taken from me because of this illness. But that said, my 20 plus years of singing experience did lead to one thing that was somewhat of a silver lining, and that is a technique that you won't find in any medical journal anywhere that will help you get this mucus out, clear it effectively without sitting there hacking over and over and over again, without breaking your bones. Because a big part of what happens is when you go to cough, it can produce this, when it's the thick mucus, the air has nowhere to go. It gets trapped. And because it gets trapped, it causes this back pressure where the air just gets stuck, and then your whole lungs go, and they brace, and they get rigid, and that causes fractures. The mucus itself, man, if you get it stuck in your airway in the right position, it can straight up kill you. I've had countless days where mucus got trapped in some area or another, and I would check my SpO2, my pulse ox, and my pulse ox would be sitting there in the 80s or maybe even lower sometimes. And the other thing is that when you have mucus trapped in your airways like that, your inhalers are oftentimes just not enough on their own. You need something else. And I've tried it all, right? I've tried the huff methods, I've tried the flutter devices, I've tried everything, and none of it has worked for me in the past. None of it would allow me to clear this mucus in any reasonable time frame that would prevent all this body damage. And so what I did is I realized something, okay, as a singer. So if you're singing the right way, it actually takes a lot of technique. And a lot of that technique comes from your body. It comes from the way you use your core and your abdominal muscles and the muscles that control your diaphragm and your breathing, right? And it's not just about breathing in. It's about how you control the breath as you breathe out. That's a lot of what singing is about. And so the technique that we use to control our breathing as we exhale is called support, okay? And basically what we do is we control our abdominal muscles to slow the air down from coming out. But we slow that air down by closing our vocal cords tighter. But that can create a hose situation where, it's slower, but then once it gets here, it's pew, and it shoots super fast, right? And that can be useful for coughing, And then the other thing is that what we do when we're singing, what we try to do, when we take a breath in, the muscles are doing a certain thing in our lungs, chest, abdominal area, pelvic area even. As we breathe in, basically our lungs are expanding, and so our muscles are doing whatever, they're engaging in the way that makes them expand, right? And then as we breathe out, usually people then collapse their lungs or collapse everything that controls the diaphragm. That's just standard, right? But when it comes to singing, you want the opposite. Or not the opposite, let me rephrase that. When it comes to singing, when we breathe in, of course, we want the muscles that control the lungs and cause them to expand. But when we breathe out, we still want to be controlling our lungs and our muscles in our abdomen, our pelvic area, around our chest. We want to be controlling these muscles and engaging them in exactly the same way that you would if you were breathing in still. So as you're breathing out, you're still engaging all these muscles as if you're breathing in. And so the best way to illustrate how to, and stay with me guys, because I know this is complex. I know this sounds like a pain in the butt, but I promise you, if you stick with me and you do this, it's going to make your life better. It's going to help you clear that mucus. I promise. Just give it a shot. It is worth trying. And I know it's a little long. I know, trust me, I know personally, I've been through it all. But hang with me and try to get this down, okay? Because if you do, it could seriously give you back some quality of life that you've lost, okay? So, back to our lesson. So, when we yawn, do a fake yawn with me, okay? When we yawn, you'll see that the throat actually expands. The muscles engage in a way where it makes the throat expand. And also, when we yawn, it makes all of this expand out and down, out and down. And think of that just like a gravy baster, right? So you squeeze it out, and then when it inhales, it expands. And when it expands, it pulls air in, right? And then when you want air to come out, generally you squeeze it. So that would be the same as traditional talking, right? But when we sing, the key is that we're gonna basically control that squeeze and slow it down as much as possible, okay? And by doing this, you're going to just engage all of the right muscles that make your cough more effective, that open the airways up and allow the mucus the space it needs to come out, and also to hyper close your vocal cords, meaning that anything above them, like if you guys know what I mean here, where you get the mucus and it feels like it's sitting on your vocal cords, and you and you just can't get it to clear. You cough, you do everything, you huff, you cannot get it to clear, right? This is gonna help you, okay? Because it'll hyper close your vocal cords when you engage these muscles the right way, and doing that will create, like when you put your thumb on the hose effect, and it'll help, boom, shoot that mucus out. And it'll also help you control the airflow, so that sometimes when we cough, you actually cough too hard, and then the mucus winds up behind your nasal area, and it's not going to come out like that. So sometimes you just got to recognize that and cough a little less hard and get it to come out of your mouth. And this gives you more control. It's about learning to control your coughs, not hack away. And so this is what we're going to do. So if you're doing your yawn, right? Take note of all of the muscles that you're engaging when you're on the inhale of the yawn, right? Okay, this is all big. This is going outward and down. The stomach even, and especially the stomach, is going outward and down. And if you do this right, okay, you're gonna apply quite a bit of force. Don't give yourself a hernia, but enough force to take the pressure off of the wrong areas and put it in the right areas when you cough. And so what we're gonna do now, right, is we're gonna try this. We're gonna do a S, that's S. We're just gonna hold S out. So we're gonna take the yawn, and then what we're gonna do is, now I want you to start S-ing, but while you're S-ing, keep expanding while you S out. You should feel the expansion here, here, and down, okay, while you're S-ing. That will help you learn what it feels like to make your muscles do what they would normally do when you're inhaling, but make it happen while you're exhaling. This is key. If you can figure this out, it could change your life, I'm telling you. Okay, so now there's a couple other key elements here. Another element is this. If you raise, don't raise both arms because you could hurt yourself, but raise just one arm a little bit and aim up a little bit like this. Don't go way up because you'll hurt yourself. Don't go too low, like this, okay? And when we cough like this, it can create that opening that you need, right? And sometimes if it's stuck on this side, you do this arm. And if it's stuck on this side, you do this arm. But you want to move your body. Find the position that you need to find to get that mucus a path out. It's key, that's another key here, okay? And so then what I'm going to have you do is this, all right? I'm going to tell you how to take your breath the right way. So the yawn is a big part of it because you're learning how to keep all those muscles expanding everywhere, right? But the other part of it here is this,